Due to the renovations of the hospitals, patients had to be temporarily moved to other centers, while others have been accommodated at a prefabricated material structure with a bed capacity of 84 at the back of the hospital. The same cannot be said with those housed in the tent few meters from the hospital, accommodating mostly referral patients from other regions. They complained of cold weather conditions and nurses have to endure, especially at the wee hours of the morning, and the ablution facilities that are outside appear dilapidated and unhygienic.
Honestly, we are not sleeping well in this tent. It gets very cold, especially in the evening.
Another complaint is the short supply of food, as food is supplied according to the patient's dietary needs. Following the complaints from the patients and nurses during the tour, the ministry promised to attend to their needs, starting with the supply of more blankets and communicating with the catering company to increase the amount of food.
A number of individuals have raised concern about, for example, the patients who had to be temporarily relocated from these wards that are undergoing renovation to be accommodated, for example, at the tent hospital within the hospital complex here, that perhaps they are exposed to the elements and so and so. The patients that are relocated to the field hospital are those that have been assessed and found to be fit, that yes, they can be accommodated here. And what is the reason for that? Is to ensure that the patients who need care, we don't need to send them away to their homes or perhaps to their towns and be away from the services that they require. So we are making use of the field hospital as a temporary arrangement.
So I don't want the public looking at that facility as a tent, as in we went camping and we're in a tent. It's a medical facility that can provide medical care of inpatients. What we are trying to ensure is that it's the critical patients we keep within the building because they are closer to the critical care units, they are closer to the theaters and whatnot, but patients who are relatively stable and can be discharged home thereafter is what we de-escalate to that site. So I think I wanted to bring that clarity. Obviously in winter it becomes problematic because it's cold, and even in a building like this, that complaint is still present.
Selima Henok, NBC News, Windhoek.